Is addiction hereditary? Can I get it from a family who also suffers from addiction?
Yeah, that's a great question. So the question there is addiction hereditary, and this comes nature versus nurture, right? So what is it genetic or is it environmental? Now, I don't know the answer to that one. Imagine yourself, for example, being very young and you see your parents as, as young children do, as very heroic figures or as figures of authority where you derive your principles and your ethics from. Now, if you see these individuals, being addicted to something or being, you see that sense of control as like their happiness is derived from one particular item or one particular, by doing this habit or, by drinking, for example, they derived happiness from drinking or they derived happiness from abusing their prescription medications. Maybe and you see them as this is where you're deriving your principles and your ethics and your values from as a kid. These things can be easily engraved into you. So that's the idea of nurture, right? It's environmental, not really genetic. On the other hand, it is possible to have genes that can make you it, more susceptible to addiction compared to somebody else, right? Maybe somebody else would require a little bit more relief from that pain in order for their brain to be like, hey, let's try this again. Or, hey, maybe if we take two this time, we'll have more relief versus somebody who just had relief once. Maybe they don't, genetically, they're wired to go down that route much quicker.
So, like you were saying, Will, relief plays the most important part, right? Like you keep taking that one to keep feeling better, and then you start feeling the normal feelings of feeling like you have everything figured out, and that the mental illness is not there anymore.
Yeah, especially for those people who've gone through it for so long.
Right. And Brandon, I gotta ask you: is there been any situations that you know of, or that you can understand, where addiction can be either environmental, where it is nature versus nurture, where the feelings of what you're surrounded with play an important part, or is it more? Do you think the focus of genes, where I can feel more addicted to it because my grandfather, my great great grandfather, had this illness of addiction, and they were always addicted to something that they kept doing?
I feel it has to do with environmental reasoning behind that because I feel like influence also could play a factor into that. So, for an example, let's say if a young kid, like sees like his parents, either they're doing something bad, whether it's like they're taking drugs or taking pills all the time, so they see that throughout their entire life, and they start having these little things go on through their head, like wondering like what mom and dad is taking, things like that. So I feel like that could play a factor, and also that to influence as well. So depending what your environment is at, people are more prone to either take the substance or not, depending where you're at. So, and I know like out there, like in poorer communities, people are more likely to take a substance or even get addicted to the substance because they don't have a way to either get out or try to escape some sort of feeling that they're having that they don't like. So they'll lean onto that. You know what I'm saying? So I just feel like environment plays a big factor. Genetic wise, to be honest, I'm not too sure. I mean, it could possibly be genetics as well, but mostly what I've seen, environment plays a big factor into addiction.
Especially when you're young, especially when you're starting off and you're just trying to learn about life and trying to understand. And like Dr. Tadayyon said, where we look at our family as heroic figures, but when we see our family go down difficult paths with alcoholic abuse and drug abuse, and we see that in front of our face, we kind of lose that feeling of being there with the family and losing that heroic effect of who they are. So I truly believe that environmental plays a part. But I also can agree with the point that genetics can seem to be a part of getting addicted to things. But again, I think it all starts with being self aware, and you can beat addiction, but it's going to take time. It's not something that you're going to be able to beat like right away. Everything takes time. It takes practice. It takes a lot of understanding your mental health. It's a lot of understanding who you are and figuring out what things you do get addicted to. I have friends who are dealing with beating alcohol, that and being around friends who are partying and who have difficult time just being around those kind of people makes it harder for them not to just go back into drinking again and being addicted again. So it's also maybe sometimes who you surround yourself with. Those people who, if you go and tell them like, "Hey, I'm dealing with alcohol abuse. I need you guys to help me. If we're around, please don't offer me a drink or be in those kind of situations." You know, it becomes difficult too, right? Um, so as we play a big part of understanding what our friends and family can do, it kind of leads into the next question. And what we asked Dr. Tanayon was, what are things I can ask friends or family to see if they're abusing medication? What are signs to look out for when things that are not of nature can occur?
Yeah, so I think, I don't you got to first, in order to find out if somebody is abusing, or you're concerned about someone, right? And you're concerned that somebody might be abusing their meds, or they might be, going down a path that might not be the best path. How do you approach that? How do you bring that conversation? Well, I don't think, me personally, I think the way to approach it is to look at the individual and look at what's most important for them and address the topic that what they think is the problem is. Sometimes, for example, it's difficult to be like, hey, you're taking these I see you, acting weird. I see you that you're running out of your prescriptions quickly. I see you upping your dosages. You can approach it that way. It really, but it also, could be like, hey, I've noticed you're not as happy as you used to be, or hey, I've noticed that you haven't gone, played basketball like you used to play basketball. What's going on? And maybe we can go play basketball again, or maybe we could go do this. It's really building that rapport with the individual, and building that rapport with the individual where you feel like they can confide in you, and they trust you, and they know that you have their best interests at heart. It's different for different people, right? Some people need tough love, right? Sometimes you need to show them tough love. Other people, tough love is just gonna squish them, right? It's not what they need. It's not what they want. Maybe they just need connection. Maybe they just need support. Maybe they just need somebody to listen, or maybe somebody just feels a little bit closed off and they just need space. But just reaching out and saying, hey, I've noticed if you need somebody to talk to, I just want you to know that I'm here, and go and approaching it always in a very non-judgmental way. Remember, we're all wearing glasses looking through our world through our particular lenses and filters, right? This is the way that we see the world, and the way that we see the world may not be the way that the other person is seeing the world. So we have to be willing to take off our glasses, begin to imagine what is their perception like, and then approach them in a way that best suits them, and that is non-judgmental, that is not non-confrontational, that is safe, supportive, and it builds rapport.
Sharon, I think when it comes to the conversation, it seems like it's really difficult sometimes for people just to even have that conversation. How do I even start that conversation? If I am abusing medication and you see me changing, what can you say to me? Like how do I talk to my friends about this?
Well, it's hard because I mean, as humans, like we want to be right about everything, and we want to know what to say, and we want to be able to give that advice. But a lot of the times, like our ego can get in the way of what we think is right and wrong, and a lot of the times, if especially if you don't know exactly what you need to say to your friend, like you need to drop that ego and maybe point them in the direction of a professional, especially when you kind of come at them like just wanting to fix their issues. You're not always going to be able to put yourself in their shoes. You need to be able to walk a mile in their shoes. And even if they are your best friend, your close friend, you're not always going to be able to grasp onto something that's relatable and give them the best advice for it. So a lot of the times, like you really just need to be a good listener, and you need to be able to internalize, sit there and really process what they're saying to you, the pain that they're going through. If it's addiction, you can kind of like send out feelers for them to latch onto a conversation with you. But when it comes to professional help, like you need to point them in the direction that is best for them, not what you think is the right thing to say in that moment in time.
I really loved how you said listen. And I feel like as humans these days, we feel like we lose one of the most important parts when we do get into a conversation where we don't have that connection. We don't understand what that person is going through. So we have to try to absorb whatever we can from the person that's describing how they're feeling. And the issue is we do just give our 2 cents way too
Yeah,
quickly.
exactly.
We just can't, when you don't know how to connect with someone and they're dealing with something that you've never dealt with, you kind of go down the road of I'm just going to throw them things that have helped me in other situations that might be able to help them. When the things that you're saying actually, and throwing your 2 cents right away, can actually hurt the person because you're not taking the time to absorb the information that they're giving you. And that is the issue that we have these days, is like we don't genuinely listen to people. And that's something that we really need to fix, is we need to genuinely listen to people and see what they're dealing with. Sometimes when I'm upset and I'm in a depressive episode, if I come to you and I start expressing how I feel, and then you jump right into fix mode, or here's what I did or what I can do, it kind of puts me off, like you don't understand what I'm actually going through, which is okay. But I need you sometimes just to listen to me, to listen to how I feel, to understand my emotion. Sometimes all you need to really do is go through the emotions with them. And truly, if I've had friends that have given me their 2 cents and it didn't help, but I've also had friends who sat there and just listened and genuinely understood what I'm going through, which helped me a lot more in the end. Is there anything that you think, Will, when we lose this genuosity of listening, what can we do to better connect with the people that we don't understand their feelings and put on the glasses that we need to actually understand who or what they're going through?
I feel like these situations usually happen when you're like face to face with a person, right? And that can make it harder because you also have to sit there and they kind of, I feel like, especially with me, like sometimes I act, not act, I expect a response right away. And so like that puts pressure on the other person or on you if you're the person helping. There's also the situation of where, hey, maybe they're just texting you or they're calling you. And I know there are people who have talked to me and people that I've talked to and gotten help, and it's good to address something right away. Sometimes that I've found to help, and is that before you start getting into things, you say like, "Hey, okay." I understand what maybe they start and you realize this is this type of situation. Right away, just address like, hey, what is this? Do you like what do you want from me? And it's okay to ask that. Like, do you want me to listen or do you want me to help you fix it? And
Right.
usually that other person, in my experience, is very open there. They might even say like, I don't know, and then you have to make a cautious decision to where I would say probably listen and sit with that information at first. But again, like Cheyenne said, you're not going to know the answer to everything, and there's going to come a point where you have to say like, you can say like, hey, maybe you should talk to this person, or hey, maybe you should get help from somebody. And that's okay to say, especially if they're your, I imagine if a situation like this, and in my experience, it's always a close friend or someone who has that trust in you to come talk to you in the first place. They are okay with any answer you give them for the most part, as long as you're putting yourself in their shoes and not just saying, oh, this is what you need to do, like get over it, as long as you're receptive.
Right. And being receptive is extremely important. Again, listen, I loved how you said ask them what you need help with. Sometimes all we need to do is just ask the right questions, or just actually just sit there and listen. And that person will tell you what they need help with. And if they say I don't know, I think that's a perfect time to go and explore with them the issues that are resulting and what you guys can do. Because, I mean, if it's your best friend, brother, sibling, whatever it is, the person that's coming to you actually trusts you a lot. I don't go and just start blabbing my problems out to anybody, especially my depressive episodes. I go to the people that mean to me and that I can trust them. So if someone's coming to you and describing what's going on in their life, they really trust you. And they need you at that time to just either listen, help them with whatever they need. So maybe sometimes ask the question of, what do you need me to do?